Are your muscles shrinking faster than you think? Most seniors don't realize that a single missing vitamin could be silently stealing their strength. Shocking, right? In the next few minutes, you'll discover what this vital nutrient is and how its absence might be accelerating muscle loss as you age. If you care about your health or the well-being of someone you love, this is a must-watch. Don't let this silent threat go unnoticed. Like and share this video now, because just one simple action could protect years of independence, mobility, and life quality. Let's dive into the truth behind this muscle mystery. Number 1. Vitamin D. As we age, one of the most common yet overlooked threats to our independence is muscle loss. But did you know that a silent deficiency could be speeding up this decline? Let's talk about vitamin D, often called the sunshine vitamin, and why it may be the most important nutrient you're missing. Vitamin D is essential for calcium absorption, which we usually associate with bone health. But here's what many people don't realize: vitamin D also plays a crucial role in maintaining muscle mass and strength. It interacts directly with muscle cells, helping them contract efficiently and regenerate after use. When vitamin D is low, your muscles can become weak, uncoordinated, and more prone to injury, even if you're eating a healthy diet or staying active. In fact, research has shown that seniors with low vitamin D levels are more likely to suffer falls, frailty, and overall loss of mobility. And here's something even more surprising: muscle fibers have vitamin D receptors. Yes, your muscles are literally built to work with this vitamin. Without enough of it, your body starts breaking down muscle faster than it can repair it. Now here's a question for you: when was the last time you spent at least 15 minutes in the sun without sunscreen, or had your vitamin D levels checked by a doctor? Think about that. If you've been spending more time indoors, which many seniors do for safety or comfort, you could be unknowingly running on empty when it comes to this vital nutrient. But don't worry, boosting your vitamin D levels is easier than you think. Natural sunlight is the best source. Just 10 to 20 minutes of gentle morning sun on your skin can stimulate your body to produce what it needs. However, in cloudy regions or during winter, food and supplements become essential. Great dietary sources include fatty fish like salmon, mackerel, and sardines, egg yolks, fortified foods such as milk, orange juice, and cereal. Still, many seniors don't get enough through food alone, which is why doctors often recommend a daily supplement, especially for those over 65. But remember, more isn't always better. Excessive vitamin D can cause health issues too. That's why it's important to get tested and follow your healthcare provider's advice on the right dosage. Here's something to consider and maybe even share in the comments: have you or a loved one ever noticed feeling stronger, more energetic, or steadier on your feet after spending more time outdoors or starting a vitamin D supplement? Your story could help someone else realize what they're missing. So, the next time you step outside into the sunshine, smile. You're not just enjoying the day, you're also feeding your muscles something they absolutely need. Stay with us, because in the next part, we'll uncover another vital vitamin that could be affecting your strength more than you realize: vitamin B12, the nerve and energy powerhouse. Number 2. Vitamin B12. Let's continue our journey into the world of essential vitamins for seniors. After vitamin D, the next major player in protecting your muscles and maintaining your independence is vitamin B12, and it might be even more important than you think. Vitamin B12 is often called the energy vitamin, but it does so much more than just fight fatigue. This powerhouse nutrient is critical for nerve health, red blood cell production, and the smooth functioning of your brain and muscles. Without it, your body can't send proper signals from your brain to your muscles, which leads to weakness, instability, and even difficulty walking or keeping your balance. Here's the kicker: B12 deficiency is extremely common in seniors. As we age, our stomach produces less acid, which is necessary to absorb B12 from food. That means even if you're eating right, like having meat, eggs, or dairy, you still might not be getting enough into your bloodstream. Ask yourself this: have you ever felt unusually tired, dizzy, or noticed numbness or tingling in your hands or feet, and just brushed it off as getting older? It might not be aging, it could be low B12, and that's serious. B12 deficiency doesn't just affect your energy, it can lead to nerve damage, muscle weakness, loss of coordination, and even memory problems if left untreated for too long. Some seniors have even been misdiagnosed with early dementia or neurological conditions when it was simply a treatable lack of vitamin B12. So how do you get enough B12? Here are some of the best sources: meat, especially liver and beef, fish and shellfish, eggs and dairy products, fortified cereals, and nutritional yeast. But again, absorption is the real issue, and that's why many older adults benefit from B12 supplements or even injections, especially if their levels are very low. And here's something important: B12 is water-soluble, so your body doesn't store it easily. Regular intake is key. The good news? It's very safe and inexpensive to supplement under medical guidance, so here's a thought for you. What would you do differently if you suddenly had more energy, better balance, and clearer thinking just from fixing a hidden vitamin deficiency? It's not magic. It's science. And it's something you can act on today. Make sure to ask your doctor about testing your B12 levels, especially if you're experiencing fatigue, balance issues, or brain fog. It could be the first step to feeling like yourself again. In our next lesson, we'll explore vitamin E, a powerful antioxidant that fights muscle damage from the inside out. You don't want to miss it. Number 3. Vitamin E. As we dive deeper into the vitamins that matter most for senior muscle health, we come to a true unsung hero, vitamin E. You've probably heard about it for skincare or anti-aging, but did you know vitamin E plays a major role in protecting your muscles from damage and supporting recovery? For seniors, this is a game changer. So, what exactly does vitamin E do? Vitamin E is a powerful antioxidant. That means it helps fight off free radicals, harmful molecules that build up in the body due to aging, stress, poor diet, and even normal physical activity. These free radicals can cause damage to your cells, including muscle fibers. Over time, this damage can lead to muscle weakness, slower recovery after activity, and even increased risk of injury. Imagine your muscles as a team of hard workers. Vitamin E is like the protective gear they wear to stay safe. Without it, they're more vulnerable to wear and tear, especially as you get older. Here's something to ask yourself: have you ever felt like your body takes longer to recover after simple tasks, like walking, gardening, or lifting something light? That slow recovery might not just be old age. It could be a sign your muscles aren't getting the antioxidant support they need. What's even more fascinating is that vitamin E doesn't just protect your muscles, it also supports their growth and regeneration. It helps reduce inflammation, improve blood circulation, and even supports the health of your skin and immune system. All of these are critical for aging well and staying active. Where can you find vitamin E? Here are some excellent sources: nuts and seeds, especially almonds and sunflower seeds, spinach and other leafy greens, avocados, vegetable oils like sunflower or safflower oil, fortified cereals. But there's a catch: too much vitamin E from supplements can be harmful, especially if you're on medications like blood thinners. So it's best to get it from food or consult your doctor about safe supplement levels. Now here's a question to think about: if your muscles could talk, would they be asking for help or silently struggling under the surface? Your body might be trying to tell you something through soreness, fatigue, or slower healing. Vitamin E could be the support system your muscles are quietly craving. So next time you reach for a snack, try a handful of almonds or toss some spinach into your salad. A small change could make a big difference. Stay tuned, because next, we're uncovering the surprising ways vitamin C supports not just your immune system, but your entire muscular structure. You won't want to miss it. Number 4. Vitamin C. When you think of vitamin C, you probably imagine orange juice, immune boosts, or fighting off colds. But here's something most seniors don't know: vitamin C is absolutely essential for maintaining muscle strength and flexibility, and it could be the missing link in your fight against age-related muscle loss. So what does vitamin C really do for your muscles? Its most powerful role is in producing collagen, the protein that forms the structure of muscles, tendons, ligaments, and skin. Think of collagen as the glue that holds your muscular system together. Without enough vitamin C, your body can't make or maintain collagen properly, leading to weaker muscles, reduced flexibility, slower recovery, and even joint pain. Let's take a moment to ask, when was the last time you thought about the infrastructure of your muscles, not just their size or strength, but what holds them together? This is where vitamin C quietly shines. In addition to collagen production, vitamin C is also a potent antioxidant. fighting off muscle-damaging free radicals and reducing inflammation after activity. That means better recovery, less soreness, and stronger protection from wear and tear. And there's more, vitamin C helps your body absorb iron, which is crucial for oxygen-rich blood. Muscles need oxygen to function and grow. Without it, you may feel tired, weak, or short of breath during physical activity. Best of all, vitamin C is easy to get from delicious foods. Some top sources include oranges, strawberries, kiwi, and grapefruit, red and green bell peppers, broccoli, Brussels sprouts, and spinach, tomatoes and tomato juice. It's a water-soluble vitamin, so your body doesn't store it for long. You need to replenish it daily. Fresh fruits and vegetables are the best and safest sources, but a low-dose supplement can help if your diet is limited. Now here's something to reflect on. If you could support your muscles, joints, and energy levels all with one simple vitamin, why wouldn't you? Adding more vitamin C to your daily life could help you move more freely, recover faster, and live with less pain and more power. And here's a quick tip. Try starting your day with a fruit smoothie loaded with strawberries, oranges, and a handful of spinach. It's an easy, tasty way to give your body the vitamin C it needs to stay strong. Up next, we're diving into a lesser-known, but incredibly important, vitamin for senior muscle and bone health, vitamin K2. Don't miss what it can do to protect your strength and mobility. Number 5. Vitamin K2. Most people have heard of vitamin K, especially in relation to blood clotting, but very few understand the unique and powerful role of vitamin K2 in preserving muscle and bone strength, particularly in seniors. And if you're worried about falls, fractures, or shrinking muscle mass, this little-known nutrient might be exactly what your body is begging for. So, what makes vitamin K2 so special? Unlike vitamin K1, found in leafy greens, K2 works deep inside your body to direct calcium to the right places, into your bones and teeth, and away from soft tissues like your arteries and joints. That means stronger bones and smoother muscle function, but here's what most don't realize: healthy bones support healthy muscles. The two systems work together like a team. If your bones are brittle or misaligned due to calcium being deposited in the wrong places, your muscles have to work harder to compensate, often leading to strain, fatigue, weakness, or even injury. Now here's something to think about. Are you taking calcium or vitamin D supplements, but still feeling weak, stiff, or at risk for falls? It could be because you're not taking enough vitamin K2 to help your body use those nutrients properly. Even more fascinating is that vitamin K2 may help reduce inflammation in muscles, boost mitochondrial energy, your cell's power supply, and support better muscle performance, especially in older adults. Unfortunately, K2 is not easy to get from the average diet. It's found in fermented foods like natto, a Japanese dish made from fermented soybeans, hard cheeses, egg yolks, liver and other organ meats, grass-fed butter and meats. If those foods aren't part of your daily routine, you might already be low in K2 without even knowing it. Some doctors recommend a K2 supplement, especially for those taking calcium and vitamin D, but always speak with your healthcare provider first, especially if you're on blood thinners or have heart issues. Here's a powerful question to ask yourself: what if protecting your strength and mobility wasn't just about lifting weights, but also about how your body handles calcium? Vitamin K2 could be the silent hero that makes your other vitamins work better and keeps your muscles and bones in harmony. So if you've been feeling stiff, tired, or just not as sturdy on your feet, it might be time to give this overlooked vitamin the attention it deserves. Next up, we'll explore vitamin A, a surprising player in muscle growth and recovery that you absolutely shouldn't ignore. See you there. Number 6. Vitamin A. When you hear vitamin A, your first thought might be eye health. And while it's true that vitamin A is crucial for vision, especially night vision, this powerful nutrient plays an even more underappreciated role in maintaining strong, healthy muscles, something every senior needs to know. Here's the truth: vitamin A is essential for protein synthesis, the process your body uses to build and repair muscle tissue. Without enough vitamin A, your muscles can't recover properly from daily activity, let alone grow stronger with exercise. This is especially critical as we age, since muscle mass naturally declines after age 50 unless we actively support it. Now pause and ask yourself: when was the last time you thought about vitamin A as something that affects your strength, not just your sight. It might sound surprising, but without this key nutrient, your muscles could be struggling silently to repair themselves. Vitamin A also supports immune health, helping your body fight off infections that can slow down recovery. Hormonal balance, including growth hormones involved in muscle development, cell growth, especially the cells involved in regenerating damaged tissue. Even better, vitamin A works closely with other vitamins, like vitamin D and iron, to ensure proper oxygen delivery and bone support, both of which are vital for overall strength and energy. So, where do you find it? There are two types of vitamin A in food. Preformed vitamin A, retinol, found in animal-based sources like liver, very rich in A, so consume moderately. Eggs, dairy products like cheese and whole milk. Provitamin A, beta-carotene, found in plant-based foods like carrots, sweet potatoes, spinach and kale, mangoes, and apricots. Your body converts beta-carotene into usable vitamin A, especially when consumed with healthy fats, but caution is key: too much vitamin A, particularly from supplements, can be toxic. That's why it's important to get it mainly from food sources unless your doctor recommends otherwise. So here's your reflection for today. What if the real reason your muscles feel slow to recover or seem to be shrinking isn't just age, but a lack of the nutrients that tell your body to rebuild? Vitamin A may be the missing piece of your muscle repair puzzle. As you can see, muscle strength in your senior years isn't just about movement, it's also about smart nutrition. And each of these 6 vitamins, A, D, B12, E, C, K2, and A, plays a unique, irreplaceable role. Want to keep your strength, energy, and independence for years to come? Start with the food on your plate and the wisdom in your daily habits. Conclusion: if you benefited from this video, even just a little, please take a moment to share your thoughts in the comments below. Have you ever struggled with muscle loss, weakness, or slow recovery? Which of these 6 vitamins surprised you the most? Your experience could inspire or help someone else in our community. Your voice matters. When we talk, we learn from each other, and that's how we grow stronger together. So don't scroll away, drop a comment, like the video, and share it with someone you care about. Let's keep this important conversation going. Your story could change someone's life today.